everyone, my name is Stephanie. I am 26 years old and I have endometriosis. I am making a video to kind of just explain what endometriosis is, the symptoms that I have experienced, my personal journey with endometriosis, and to just kind of give people a better understanding about endometriosis. So if you've seen any of my other videos, I have talked about endometriosis in the past, and I've always gotten a lot of questions, about what treatments I've done and what's helped for me, what hasn't, and things like that. Pretty much, endometriosis is a condition where the lining of the uterus is implanted elsewhere other than the uterus. Common places are the ovaries, the fallopian tubes, the bowels, or just anywhere in the abdominal cavity, really. So these lesions of endometrial tissue act just like the endometrial tissue that's in your uterus, meaning it thickens every month with your hormones, and it also sheds every month. Usually when this takes place in the uterus, it's fine. That lining that gets shed is our period. But with endometriosis, these lesions, when they shed, they have nowhere to go. So that causes a lot of inflammation and a lot of pain for a lot of women. Over time, these lesions can build up and they can cause cysts and adhesions and scar tissue. And it can ultimately end up kind of making your pelvis kind of frozen. So pretty much meaning like your ovaries are stuck, they're not moving, your, bowel could be affected, your urethra could be affected, your bladder could be affected. Some women only get severe pain with their period. Other women get this severe pain every single day. So I get pain every single day, no matter what I do. I can, just be sitting at home and I still get crazy pain. There's really no rhyme or reason to my pain. I do have certain things that do flare it. So when I'm ovulating, I do get an increased pain response. And then obviously when I'm on my period, I also get an increased pain response. I was diagnosed with endometriosis about 3 or 4 years ago now, and it was a long road to get to my diagnosis. It wasn't easy. I had to see a lot of doctors, and it took about a year for them to actually take me seriously and to take my pain seriously. I was one of the lucky ones. Usually, the average is 5 to 6 years before you get a diagnosis from the time you start seeing a doctor for your symptoms. The reason for this is because there's no scan that shows endometriosis. There's no blood work that shows it. There's no definitive way to diagnose endometriosis without surgery. That is the golden standard right now, which is why it takes so long for doctors to diagnose it, is because no one wants to jump straight to surgery to diagnose why is this woman having pain. I was told several times that my pain was in my head and that I was just stressed out and it was normal for a woman to have this kind of pain and I just needed to get used to it. But I knew there was something wrong. When your pain is to the point where you're having to use narcotic pain medication, that's not normal pain. Periods should not be excruciatingly painful to the point where you're crying and going to the emergency room. And that's what was happening to me. Even when I wasn't on my period, the pain was still just so intense and so crazy that I wound up in the emergency room at least once a month because this pain was just so ridiculous and I just could not cope with it by myself. It was the hardest thing I've ever gone through. You know that you're in so much pain. You know there's got to be a reason. My friends had seen it. My husband now, who was my boyfriend at the time, he saw me in this pain. All my friends were like, why aren't they figuring out what's wrong with you? Your pain is obviously real. You're curled up in a ball crying and you can't move. Your pain is real. When you're told by so many doctors that there's no way you can be in this much pain, there's nothing physically wrong with you, you do start to doubt it. It's such a terrible feeling. You feel like you're going crazy. I struggled with that for quite a while. I hit a breaking point and I was like, no, this pain is real. Somebody is going to listen to me. I went to my doctor and I said, look, my mom had this and my grandma might have had it as well. And I was like, I think I need to see an OBGYN because I feel like this is at least something that's worth exploring. You know, I'd been dealing with this pain for over a year at this point, and I was at my wit's end. I just wanted to know what was wrong. If you're in pain and you don't know why, it's very difficult to deal with. So I really just wanted a reason. And I knew endometriosis, you know, there's no cure for endometriosis. It's a chronic illness. There's nothing they can do. They can try to treat your symptoms, and that really requires hormone therapy, surgeries, and pain relief. I went and I saw an OBGYN, sat down with her. No, it was him. I sat down with him and I explained to him all of my symptoms and my mother's history and my grandmother's history. And he said, yeah, I think it's very likely that you could have endometriosis. So we have a couple options of what we can do. We can give you this birth control, you know, this really powerful birth control to try and, you know, calm your hormones down so that the pain doesn't get any worse, and it might relieve some of your pain that you're, you know, already in. And if it works, then we kind of know that it probably is endometriosis. Or our second option is that we can do a laparoscopic surgery and look for it and then base our treatment off of what we find. And because I had already been dealing with this for so long at this point, so I told the doctor, I know it's surgery, but at the point that I'm at, I just want a definitive diagnosis so we know for sure. And he said, I completely understand that after everything that you've been through. So he went ahead and he booked my surgery. So that was in 2015. You know, I remember waking up from surgery asking how long it took, because I was told that it should only take 30 to 45 minutes depending on how bad it was. So it turned out my surgery was more about an hour and a half to 2 hours. From hearing that, I kind of knew they must have found endometriosis. And then once I kind of came around a little bit more, I was wheeled into the recovery room. My husband, my boyfriend at the time, was in there waiting for me, and the doctor had spoken to him, and I just looked at him and I said, did he find endometriosis? He found it, and I just started crying. And it was such a relief to know that my pain was real. It was the validation that I needed, and it made all of the pain that I went through easier. That was awesome. You know, I finally have the diagnosis. You know, once you get the diagnosis, then it's a whole nother set of problems that you have to deal with. There's no cure for endometriosis. So I was in very severe pain, even though I only had mild to moderate endometriosis. So once I got my diagnosis, you know, we kind of went back to the drawing board. Okay, what do we do now? How do we manage my symptoms? My OBGYN wanted me to start a hormonal birth control again, which I was all for. You know, I wasn't planning on getting pregnant. I wasn't engaged. I wasn't married. You know, I had my boyfriend, who is now my husband, but we weren't at that stage. We had only been together for about a year. So I got put on Depo-Provera. You know, you get it every 3 months, and it's supposed to completely just like quiet your ovaries. But I was still getting my period while I was on it, and it wasn't helping my pain. I started seeing a pelvic physical therapist, and then I was further diagnosed with pelvic floor dysfunction, which is pretty much because my pelvis was in all of this pain all the time. My pelvic floor muscles were just constantly in spasm. That's still an issue that I deal with to this day. Pelvic floor physical therapy did help me. It is very, very awkward because it's exactly what it sounds like. It is physical therapy for your vagina. There's no other way to put it. You go in and it's kind of like a massage parlor feel to it. My physical therapist was amazing. I loved her. She made me feel so comfortable with everything. She made sure that I knew what she was doing, why she was doing it, why it was important, and that it wasn't causing me any pain, or if it was, that I was relaying that to her so she would kind of know. And then the best part of each session was we ended with a TENS unit on my stomach and on my back, and then a heating pad. It's amazing. After we did pelvic floor physical therapy, we tried Botox in my vagina. Yeah, that was an experience. The reason that we were doing that is because, you know, Botox is a muscle paralytic, pretty much. You inject it into the muscle and the muscle doesn't move anymore. It's used for migraines as well, and it's also used for pelvic floor dysfunction. So I was at my wit's end because this pain was still so terrible. I had been on so many different pharmaceutical medications and nothing was working. And my doctor was like, well, do you want to try this? He said, I can't guarantee that it's going to work, but some women do get relief from this. So I was like, you know what? I've tried everything else. Let me give it a shot. It was an experience. Let me tell you that. I will never do it again. Never, never, never. It was extremely painful to get the shots, and I didn't get any pain relief from it. That's fine. I know not to do it again. They warned me beforehand, like before the procedure, that it was going to be painful. And I was like, oh yeah, you know, I'm used to pain. I have a high pain tolerance. I'll be fine. I was wrong. So they take the shot of Botox. You have a speculum in, and they inject Botox into your vagina. And they were like, yeah, it's gonna hurt, so just let us know if you need a break. I told the doctor, I was like, oh no, the quicker we get it done with, the better. She started doing the injections. First one, I was like, ooh, okay. It hurt so badly. I did end up having to take a break. I was like, no. Like, you need to stop. I need to breathe. I need to take a break. I can't do this. So we took a break for, 30 seconds or so, and then we started again. I will never do it again, but I am glad that I at least tried it because now I know it doesn't work. What else have I tried? Lupron. Everybody's favorite thing to help endometriosis. My experience with Lupron was terrible. For those of you who don't know, Lupron is actually a drug that is used to treat testicular cancer in men. It completely stops estrogen production, puts you into a temporary menopause if it's given to a woman. So you go through this sudden chemical menopause and you get all the symptoms from it. You get the moodiness, you get the hot flashes, the crazy feeling. And if you're lucky, it will help your endometriosis pain. If you're not lucky though, like me, it won't help your pain, but you'll still get all these symptoms and you'll be bleeding on top of it. I will not personally recommend Lupron to anybody. For me, the risks outweigh the benefits. Make sure before you do Lupron, you are well informed, do your own research, try and get a good idea of what you're actually putting into your body. I knew all of the negative sides of it, but I was at the point where I need to try this because I need to try and see if it will help my pain. So after that, I didn't go on anything hormonal, and I was controlling my pain with ibuprofen, Tylenol, Tramadol when needed, and Percocet or Vicodin when needed. And I did need it. I needed strong pain medication because my pain would get really, really bad, and it still gets really bad. So let's talk about endometriosis pain. I get pain every single day. I literally cannot remember the last day I was not in pain. My daily pain is kind of an overall aching and sore feeling. So if we're talking the pain scale, on a scale from 0 to 10, 10 being the worst pain you've ever felt in your life, 0 being no pain at all, my daily pain is about a 4 or a 5. So it's still pretty strong. Kind of just feels very sore, painful to move. Exercise makes it worse for me. And certain foods also make it worse. For me, red meat is my biggest food that I stay away from because if I eat red meat the next day, my pain is just ridiculous. So my severe pain, which happens probably 2 to 3 weeks out of a month, usually around my ovulation time, my period, and then the week after my period. I have certain ways that I describe it to people that are kind of easy for other people to understand. So one of the ways I describe it is imagine that your uterus and your ovaries were covered in burn blisters. And every time you move, even if you move just a tiny bit, those blisters are rubbing up against each other or rubbing up against other parts of your body. And they're bursting and they're ripping, and it's just this raw feeling. Oh, it's so painful. It feels like someone is pouring molten lava in my abdominal cavity. On top of that, I get the really bad cramps, which are like, how I describe them, period cramps on crack. It's not just your normal like, oh, I have my period cramps. These cramps are like ridiculously intense. Like someone is squeezing your uterus, trying to just crumble it, rip it apart. Sometimes that pain is more isolated to one side than the other. Sometimes it's pretty much the same on both sides. And then I also get back pain associated with all of this. And that pain feels like someone is squeezing my spine like this, and they're squeezing it really, really hard as if they're trying to crumble my spine. And then it also feels like someone's kind of punching me on either side of my spine. So I get this like muscular pain as well, and that's from my muscles spasming from all of the pain. I also get my pelvic floor dysfunction pain, which feels like I am being stabbed in the vagina. My pain can be severe, and I can still act like I am not in pain because I've been dealing with this pain for so long that if I let this pain just completely dictate my entire life, I would never do anything. So I have to be normal even when I'm in a bunch of pain, because I have to live. My pain doesn't make all of my other responsibilities go away. So I have found ways to deal with my pain internally so that I can still get everything done and not show everybody how much pain I'm in. Because I don't like people feeling sorry for me when they see how much pain I'm in. So I will just put on a happy face and act like everything's okay. But my pain is exactly that. It's my pain. I don't feel the need to justify my pain to anybody anymore because I do have this diagnosis of endometriosis that is known to cause chronic pain. If you have recently been diagnosed with endometriosis and you are looking for some good resources, I highly recommend the book Stop Endometriosis and Pelvic Pain. I will try to link it in the description below. If you have any questions about endometriosis, you want to know anything specific, feel free to leave a comment down below and I will try to get back to you. I will be making another video about how I manage my pain, more specifically with my TENS unit, my heating pads, and what medications I take or have taken in the past that have helped. So if you're interested in seeing a video like that, feel free to subscribe so that you'll get an update when I do post that video. Thanks for watching, guys. I hope you have a happy and pain-free day.